All right, let's see how this does from the car. I want to make a video that really has nothing to do with me, but maybe you'll think that it does if you're listening to the words that I am saying. So I want you to listen carefully, please. You know, when it comes to being a healthcare provider, really on any level, and it's probably more commonplace with like physical therapists, chiropractors, maybe acupuncturists, or other people that are like primary entry points of care for people who maybe want to go least invasive, least expensive routes before they're stepping into like the mainstream medical where they're consulting with surgeons and getting put on medication. And that is that, you know, you hear so much from people like, you know, lose weight and you'll feel better. Eat a healthy diet and you'll have less inflammation. You know, exercise and eat better, you know, like those very generic things. And we all know that science over time and study after study, no matter how performed, has kind of probably shown that if you eat less and move more, you'll be thinner. And if you're thinner, you won't have as much stress on your joints and you won't be at high risk for cardiovascular disease and diabetes. And if you don't eat fast food and sugar, your inflammatory markers will be lower when you get blood work and these commonalities and things of this nature. Then you hear about outliers, but we're not going to talk about outliers. We're going to say sometimes, no matter what you do, no matter how much it may look like, well, you're not working hard enough and you're the one that's accountable and you know, they're exaggerating or they can't possibly be that injured. The reality is, as providers, right, no matter who you are now, but yes, I'm kind of talking to the primary, provider type, what do they call it? Primary care physician, maybe the person that's like, again, not the specialist, the chiropractors, the PTs, the acupuncturists. I already said I don't want to repeat myself. I like to go down rabbit holes and I stutter a little bit. But it is your job to evaluate harder. It is your job to be more thorough. It is your job to sometimes order the imaging that is necessary to be able to identify things, or do an advanced test to be able to come up with a reasonable differential diagnosis that gives somebody a chance to get the help they need. Not to say, oh, because of what I did and what I do most of the time didn't work, they obviously have like another problem or they're exaggerating. You can't say, well, I'm not able to help them, so I'm just going to give them a referral and just kick them off to the curb. And it's important that providers out there do better and do their best always, because that's what you signed up for. And it's important that patients, that you're your own advocate to the point that you also have to understand that the people you're working with are human. And when people build a busy practice, because they are good at what they do, that their time has to be utilized wisely to be able to serve everyone. Which all kind of boils down to this. Both ways, patient, doctor. Be kind, be reasonable, be rational, do your best, both parties involved. And don't ever write anybody off because, I hope that makes sense, and y'all have a great day.